And we begin here at 5:30 with the coronavirus, and the numbers have shot right back up from the holiday. 16,530 new cases over the past 2 days. That averages out to 8,200 cases per day. 358 new deaths are also being reported, including 160 from a review of vital records.
The 7-day moving average cases have trended down over the past 3 Wednesdays, but some of that trend can be attributed to the holiday. Back on November 17th, we were averaging 7,300 cases per day. Today, the average sits at close to 6,000 cases per day, and it comes as the first case of the Omicron variant has been detected in the United States.
It was found in California in a person who had traveled from South Africa. The individual was vaccinated but had not received a booster. They're said to be suffering mild symptoms that are improving. For more on what this means and the latest on the situation here in Michigan, we turn things now to our Dr. Frank McGeorge. Hi, Frank.
Hey, Kim and Devin. Yeah, the Omicron variant is obviously concerning, but we are already facing a critical situation right here in Michigan as we head further into the winter. I can honestly say working in the hospital this weekend confirmed what the state's data shows, and that is there is again a dangerous strain being felt in our hospitals. The latest statewide hospitalization data show not only are COVID hospitalizations on a steep rise, they have now gone above the levels seen during the last winter and the highs of our spring surge. Intensive care unit patient numbers have also already risen above the spring peak. Now, another concerning trend to be aware of is a sharp increase in cases being seen among residents of adult foster care, homes for the aged, and skilled nursing facilities. During the spring surge, residents in these facilities did not see much of a rise. If you have loved ones in these facilities, encourage them to get vaccinated or boosted if they already are, and remind them of the importance of masking and distancing. Now, nationally, cases of COVID-19 appear to be plateauing, but there is increasing attention being paid to the newest Omicron variant, now officially identified in the U.S.
The California and San Francisco Departments of Public Health and the CDC have confirmed that a recent case of COVID-19 among an individual in California was caused by the Omicron variant. Here's what we know right now. The individual was a traveler who returned from South Africa on November the 22nd and tested positive on November the 29th. The individual is self-quarantining, and all close contacts have been contacted, and all close contacts thus far have tested negative.
Now, we're now 6 days post-Thanksgiving, which means people who were exposed to COVID on Thanksgiving Day have reached the point where they will start testing positive. But remember, the incubation period for COVID is actually 14 days. So that means we have another 8 days to go until we have a really good idea of how many people might actually have been exposed and be positive.
Well, Frank, what impact could this new variant, the Omicron variant, have on this surge that we're just reporting on, that we're already seeing here in the state of Michigan?
Well, Kim, it's really way too soon to know. We do expect to eventually see cases here, but whether Omicron is going to outcompete Delta or whether it's going to turn out to cause more severe illness, that's just a complete unknown at this point. But it's safe to say, though, now is really a good time to be smart about taking precautions to protect yourself and, of course, getting vaccinated.
And boosted. Okay, Dr. McGeorge, we appreciate it.